A new survey found that once pandemic restrictions lifted, only about half of women visited their doctor's offices for routine checkups and screenings. OBGYN and popular podcaster Dr. Angela Jones joins us now with more. Hi, doctor.
Good morning.
I'm happy to have you here. Did you see a decline in women coming in for their annual exams during the pandemic? And is that still happening now?
Absolutely. We saw a huge decline in the number of women that were coming in for routine screenings. And now, with vaccines having been rolled out, a lot of women are slowly starting to return to getting those annuals and screenings.
So, what are some of the most interesting or alarming statistics from the Prevent Cancer Foundation survey?
Wow, where to begin? What I would say is the pandemic certainly had a huge impact in, the number of patients not coming in to visit their PCPs or their OBGYNs. But unfortunately, the pandemic was not the only reason that women hadn't scheduled these annuals. The Prevent Cancer Foundation, one of the surveys that they did showed that a whopping 25%, nearly a quarter of women between the ages of 40 and 60 had not even seen their OBGYN or PCP in like 36 months. I mean, that's pretty astounding. Forget the pandemic, women still just weren't coming in, which certainly needs to change because, as you mentioned, these screening tests, mammogram, pap smears, are crucial in detecting cancer early and, hoping to guarantee a good outcome.
How often should women be screened for cancers like cervical cancer or breast cancer?
That's going to depend on your age. The American College of OBGYN recommends annual mammography starting at the age of 40. Certainly, if you have a history of a first-degree relative, i.e. mom, dad, siblings that have breast cancer, then your screening would begin 10 years prior to the age of their diagnosis. With regards to cervical cancer screening begins at the age of 21. Between the ages of 21 and 30, you can certainly get a pap smear, every 3 years. Between the ages of 30 and 65, the frequency of your screening is going to depend on the type of testing that you have done. If it's just a straight pap smear, then that's every 3 years. If you get a pap smear with HPV co-testing, then that can be spaced out to every 5 years, granted that the results from those tests are normal.
And I know that nearly 40% of women reported having worries about feeling discomfort or awkwardness during a routine breast and cervical cancer examination. What do you say about that part of it?
I would say to women, first of all, make sure that you have a provider that you are comfortable with. Women have so much power, and I always empower women and let them know you always have a choice. Your health is first and foremost because we know that women are really the bedrock and the foundation of society. So certainly you want to make sure that you're seeing a provider that you are comfortable with. You want to make sure that you're seeing a provider that educates you, empowers you, and that you feel comfortable, fully disclosing any issues or concerns that you have. Certainly your ability to do that is going to lead to your receiving best practice medical care.
And where can people go to learn more about early detection in general and also cancer prevention?
You can go to preventcancer.org/back on the bug. That's a great resource to learn more about cancer preventative measures and screening guidelines.
All right, Dr. Jones, I want to thank you for being with us. We really appreciate it. And we will be right back with more Midday Maryland right after this. Stay tuned.